going to speak about the usage of verified credentials for zero trust architectures, specifically in the area of cross-border health services. So it's a pleasure to be here today with all of you. I will be devoting my presentation to a few parts. In the first part, we will be discussing about zero trust a bit. In the second part, we'll be introducing the self-sovereign identity management approach, and then we will be reviewing how this SSI and zero trust approach can receive legal effect by reviewing the new EIDAS2 proposal by the European Commission. And I will be using the e-health environment as an example, but of course this approach can be applied to any other kind of credentials. So regarding zero trust, this is a new approach, which is providing a collection of concepts and ideas which are designed to minimize uncertainty in enforcing accurate and least privileged request access decisions. It means that we don't want to rely on the underlying infrastructure to make any trust decision, but on the contrary, to decide without any previous information whether to give access control or not. In this approach, we are working on zero trust architectures, which are approaches to cybersecurity that use these zero trust concepts and encompass component relationships, workflow planning, and access policies. It is true that zero trust architectures are not betting on any kind of identity management approach, but it is nevertheless true that it fosters the adoption of the new decentralized identity management systems approach, which is something which is really related to what we call as several self-sovereign identities. This type of identity management systems are the next evolutionary step when compared with the classical history of electronic identity management systems. We started with centralized identity management. We continued with federated and authentication delegated approaches. And after that, we implemented user centricity approaches. But in all these cases, the user was dependent on the existence of an identity provider. And this has generated a lot of inconsistencies and a lot of potential problems. And it has led the public administrations and other e-health service providers to the need of deploying models where they need to negotiate trust before starting to interchange any kind of credentials. Contrary to that, this new approach of self-sovereign identity is something that is relying on the fact that the user is central to the administration of his or her identity. That means that instead of relying on a third party for our identifiers and the management of our identity attributes, we can rely on a decentralized identity management system, such as those based on blockchains and any other verified registries, to prove three big pillars of security properties of our systems, which include controllability, in the sense that we need to exist on the internet without any dependency on a third party. And this will imply that we can generate our own decentralized identifiers. It means that we can persist on the internet, in the sense that even if our user account should be suspended, we can have still control over it, and that we have consent over any identity attribute sharing we want to do on the internet. This is the first pillar. The other two pillars include security regarding the information and portability of the information. And for this, the idea is that users, we need to have control over our identifiers, first thing, and over the identity attributes we want to get and we want to share, second thing. Here in this slide, you can see how we do that, how we can achieve that by using an architecture. In this case, I'm presenting the Alastria Identity Reference Model. Alastria is an association in Spain devoted to blockchain services. And in Alastria, we have created and deployed an identity model, which is self-sovereign by design. Here you can see the user at the center of the slide. The user has relationships with issuers, in the sense that the user is able to request identity credentials from the issuers, and then the user has relationships with service providers. In the e-health space, a user could be a patient or a user could be a medical doctor. If the user is a medical doctor, she will be able to get her identity, for instance, from a qualified true service provider issuing a qualified certificate for electronic signature. And in this sense, the qualified certificate will include the name, surname, and national ID card number. And then the user will be able to connect, for instance, with Spanish medical associations to get a credential with the professional qualification. In this sense, the user has on her wallet now a proof of her identity and a proof of her professional qualification. Then the user, in this case the medical doctor, is able to connect to a service provider, for instance, an e-health platform, to prove her identity and to prove her professional qualification. The idea of a self-sovereign approach is that the service provider doesn't need to connect to the issuer to verify anything. So the service provider can trust directly the issuer information, and that the user has full control over the disclosure of these credentials. So this is a new approach which goes further at the federated identity management approach, which we currently have implemented in the European Union with the EIDAS-1 regulation, and it provides a set of benefits, which you can see on the slide. For instance, because the identity information is not stored in a central identity provider, this new SSI approach will reduce the risk of massive identity theft, because the SSI identity provider, meaning the credential issuer, does not intervene anymore in the authentication process, will reduce as well the big brother risk and, by the way, the GDPR compliance cost from this scene. And because SSI allows the user to decide which identity data to share with whom and with which limits, then we enhance user autonomy and privacy. And we enable the possibility of user-generated proofs as well. And it enables this new zero trust identity management approach, meaning that precisely we don't need to establish a trust relationship between the issuer and the relying party. So if I am a patient displaced in a member state country, I can prove my patient identity, and then the service provider will be able to access to my patient data, even if it is not known before to my original hospital, for instance. But of course, for this, we need some legal recognition. And this is what the EIDAS-2 proposal is going to provide for us. In this sense, if you look at the European Commission proposal, you will see that the European Commission has identified the need to proceed to a market transformation recognition process and to understand the EIDAS-1 limitations. And it is true that from this perspective, we need to recognize that the new environment has appeared, where we are not anymore interested just in rigid identities, just as national ID cards, but on the provision and reliance on specific attributes. So in many cases, it will be more important to check whether a patient has an insurance right than to identify only the patient's name, because with that information, we cannot resolve the proper question, which is this person to be attended and to be given health care? In this sense, the European Commission has recognized that there is an increased demand for these electronic identity solutions that can provide efficiency gains and that provide high trust, even in a cross-border transaction, and therefore, considering the inherent limitations of the EIDAS-1, namely that it is limited to the public sector and only in few cases to private sector, attending to the limited possibilities and complexity for online providers to connect to the system, which is something we are seeing in private healthcare services, due to the insufficient availability of notified EID solutions in all member states and the lack of flexibility to support all the use cases we need, it is clear that we need something new. And the European Commission has identified that the identity solutions that are not covered by the EIDAS, namely those provided by social media networks and financial institutions, do raise some problems, privacy concerns, for instance, and of course they don't have cross-border recognition, and therefore they have proposed a new identity framework. This framework is based into important new legal institutions. First of one is the EU Digital Identity Wallet. This is a product, but a service as well, which is provided by member states or under their mandate or independently, even by private sector providers, but recognized by a member state, and always under a notified electronic identification scheme of level of assurance high, which will allow us as users to request and store identity data and other identity attributes, such as my legal identity and my legal professional qualifications, and then to share this information with third parties. Important thing is that this is of mandatory acceptance by a number of public and private sector providers, including health providers which are mandated by law or by contract to carry out a strong authentication, and by very large online platforms. Therefore, it means that with this EU identity wallet, we will be able to connect and authenticate ourselves in front of the most important bodies in the European Union, thus making the digital single market promise a reality. Second part of this story is not the base identity, not the wallet where the identity is stored, but any kind of electronic documents asserting identity attributes of users. In this case, this is called an electronic attestation of identity attribute, namely identity attestation of attributes. And we have a definition for this, a legal definition that refers to them as an attestation of electronic form that allows the authentication of identity attributes. We have a qualified definition where we have attestations that comply, that fulfill a set of requirements that make them trustworthy. And then we have authentic sources. For instance, in my example of medical doctors, the medical associations will be acting as authentic sources certifying the identity of medical doctors. So in this case, there is an opportunity for these professional associations to fulfill their legal duty to certify that the medical doctor can actually work. Differently from the wallet, this is a true service, meaning that any company or any public sector body can provide them. And this implies that there will be a lot of competence out there. And this is good for ensuring that we are able to give this information to the market. And of course, for this to be trustworthy, we need some legal effects. And following the logic of the rest of two services, we have two levels of legal recognition. We have what is called the non-discrimination principle, meaning that any electronic attestation of attributes shall not be denied legal effect and admissibility as evidence in legal proceedings. So, meaning that we have harmonized a new rule of recognition for this, but where you need to prove whatever you can. On the contrary, when we issue a qualified electronic attestation of attributes, for instance, from the Spanish Medical Association, then this will receive a substantive legal effect, meaning that it will have the same legal effect as lawfully issued attestations in paper form. And this is important in terms of legal recognition on a domestic level, but on a cross-border environment level as well. Therefore, this approach will ensure patients and medical doctors can prove their legal identity and any of the identity data they need in the health space. Finally, this is my latest slide. We need to consider how to apply this in a zero-trust, attribute-based environment for cross-border health. And precisely, this is what we're proposing. The idea is to build on top of this European Digital Identity Wallet and Qualified Electronic Attestation of Attribute service from the perspective of patient, but from the perspective of a medical doctor as well. And here the idea is that as a potential use case could be to consider that a patient normally displaced in a different member state will be able to identify herself and to authorize access to an identified medical doctor in a health services organization to her patient summary in her own member state in order to check potential medical incompatibilities with the medicine being prescribed. So in this case, even if this health services organization is not known to the patient's health services organization, in zero trust architecture approach, they will be able to release the information of the patient because they will have proof that this is a correct, proper, legally authorized health service organization and the medical doctor. Same thing will help us to issue electronic prescriptions, by the way, in this case, using qualified signatures associated to the wallets, and after online patient identification, to allow pharmacists to dispense the medicine to patients. Of course, this is not the only possible use case. We can consider as well telehealth services, which is an emerging activity that poses some specific risk. We are seeing a lot of identity theft in there, so it is an area of concern. So as a conclusion, we feel we are very excited of having this new regulation, to have this new technological approach to be able to provide better health services. And thanks for your attention.